the third category that I kind of almost call my favorite surgery just as a whole is the DIEP flap procedure, which is in line with this month, the deep inferior epigastric perforator flap surgery to
So
reconstruct
that's a
breast. Yeah,
breast cancer surgery, right?
breast cancer surgery.
Yeah,
So
cool.
it's in line with October, and we do quite a few of those. And when I say we, it's usually a two surgeon gig because it's quite involved. And myself and my colleague, Dr. Mark Stalder, he's based out in New Orleans. He comes down and we do them together. And he and I trained together in general surgery days before going into plastics and finished about the same time. And we've got a good relationship and had a over the past 5 years or more, we've done numerous patients, and the process that I love about all that is watching a patient come in with just a new cancer diagnosis, kind of looking confused and already seen a couple of physicians, and kind of very much in the dumps and not in a good place. And I take the consult very slow to try to talk through every little process, every little part of it, and I make it a very important point to say that the part about my job is not, people come in and they feel like they're vain for wanting to make their breasts look good, just treat this cancer. Like, yes, of course we're treating the cancer, but the big part is that I want you to be able to look at yourself in the mirror 5, 10, 20 years down the road and go, I didn't have breast cancer. Because if you have any kind of scars that make you look like you had breast cancer, you're going to wake up every day and you're going to take your shower. You're either not going to look at yourself or you're going to look at yourself and kind of just in deep conscious, you're beating yourself up like we all do sometimes. And you're like, I have cancer. I'm a scarred cancer person, even though you're in remission. So the confidence that patients come out with on the other side after going through a big surgery, that's technically the most difficult thing that I do. And because it's a microscopic surgery where you're sewing very small blood vessels together, and to get to move the belly tissue, the tummy tuck tissue, which is just skin and fat, up to the chest, you're sewing in the artery and vein into the ribs, vessels right behind the ribs, and the glowing person that you see on the other end of that is so fulfilling to me and everybody in this office. They become like a first name basis, most of the breast cancer patients, and they are like a new person. It's a blessing in disguise for a lot of these patients, and they'll say that. They when you first get diagnosed, I mean, it's the worst thing in the world, but they come out of it shining brighter than ever. And I'm riding the wave with them. That's what I need a boost for the day. I see the next breast cancer person that came through, and I'm like, I like seeing them, overseeing them. Like, yeah, don't come back in a few months. Let me say hi to you again, that kind of thing. That's how close we are. And that's how everybody in the office is with them too. So we take a lot of pride in that patient population for sure, because of where they start and where they finish and what they go through, and we're there for every step.